Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
between monoamine oxidase A and monoamine oxidase B. We have two types of monoamine oxidase, that is A and B. Monoamine oxidase A is present in kidney, liver, intestines, placenta, and it is also present in adrenergic neuron. Whereas monoamine oxidase B is present in dopamine neurons, it is present in brain, platelets, and liver. The specific substrate of monoamine oxidase A is norepinephrine or 5-hydroxytryptophan or tryptamine, whereas the specific substrate for monoamine oxidase B is dopamine and phenylethylamine. The specific inhibitor of monoamine oxidase A is chlorgelin or moclobemide. Chlorgelin or moclobemide is a specific inhibitor of monoamine oxidase A, whereas selegelin is a specific inhibitor of monoamine oxidase B.
thank you and thank you for watching.